I'm going to do a quick blog about factor 2, the gene mutation, also called thrombophilia. And we're going to talk about the specific prothrombin 20210 mutation. It's a genetic thing. And basically, it's a clotting problem where the blood clots too easily, too quickly, and it can be different levels from mild to severe. I've seen kids where it hits them young, and I've got a case here where an SBN member wants some help on a patient who's a little bit older, in her 50s, that now has this gene and is causing a problem. Well, if it were a truly genetic problem, it would have affected them when they were much younger, like some of my other patients. So I believe this is more of an environmental thing. If this were truly genetic, that line would have died off thousands of years ago if it were an inevitable genetic condition, like I've seen on some of my patients where they get it very young. Again, I think it's more environmental because we're seeing this more and more today than was ever reported before. And I think the factors that trigger this are diet, typical diet things like bad diet, fried foods, to rice, pasta, too many carbs, things like that is a problem. And we all see that, a lack of proper nutrition, vitamins, minerals, and even heavy metals. In all my patients I've seen, they've all had a heavy metal problem. So, including copper. And that's why you got to do the hair test to see if copper is a problem for them or not. You might need to do a blood test, but at least do a copper. And if you're a person out there, someone who's got this or the family, you need to do some testing. Do a comprehensive panel like your SBN members do, like I've developed. Do a hair test because you got to see if you got high copper, maybe mercury, lead, arsenic. All those are going to affect the clotting and maybe trigger this gene to make your blood clot too easily. So in my opinion, it's very easy to take care of. Now, some of the special nutrients, first of all, you got to take care of the heavy metals, but for nutrients, vitamin E really helps to reduce platelet stickiness. And so most of my patients do far more than this, but they also do at least 800 international units of vitamin E. Make sure it's natural. Make sure has some gamma mixed tocopherols with it. Vitamin C. Vitamin E is really the main one, but we're also going to use some other nutrients too. Maybe some bromelain, some vitamin C, some magnesium. You can use some nattokinase if you want, but even though nattokinase isn't going to increase the prothrombin time, the INRPT. So I recommend that everybody does the INRPT before starting any treatment to see where your numbers are. If you're already on Coumadin or similar, generally you just can't stop, but we have had patients that have gotten off of Coumadin because they no longer need it and because their bodies are healthy enough and the INRPT and other inflammatory processes are staying at a good level. Notice I mentioned inflammatory processes. That's a driving thing behind this. If there's inflammation, your platelets are going to stick together and clot. So other inflammatory factors you need to see is CRP, C-reactive protein, severity, homocysteine are 3 very good tests to see. Now, along with that, you got to see what else is going on. I want to know what the LDH is and CK. So once you do the proper testing, it'll drive you where you need to go. But right off the bat, comprehensive blood test like we talk about in science-based nutrition. Get a hair test, and along with that blood test, also do the INRPT, prothrombin time. You know what that is. Get tested, even though it's genetic, doesn't mean it's inevitable. Genes load the gun, but our environment pulls the trigger. So if you will do some of these things, now I recommend that you get managed and followed by a trained doctor in this. And I train doctors to do this, so you can contact Science-Based Nutrition and lead you in that direction. And for the doctors listening to this, guide your patients along this way, get them tested properly, and you'll have good results. Now, I don't mean to make this too long, but one of my worst cases was a fellow who was 17, and he came in, and he had already had 3 grafts on his lower leg that they were his grafts the same area. It was about that big. He said his whole family had this condition. prothrombin 2, and he had 2 skin grafts that are about that big. Well, one, and then they repatched it, and now he's on his second patch, and it's breaking down. It's got an ulcer in it about that big, or when he first saw me, he had an ulcer about that big, and he said it's breaking down. And he was worried, what am I going to do? He's going to have to go on even stronger drugs than he is. He'd been on Coumadin, and that wasn't fixing it. Well, when we tested him, we found these things I'm talking about, and within about 2 or 3 weeks, that ulcer started to heal over. In fact, by 2 months, it did heal over. And he said that graft that was breaking down, was turning dark, turned pink again. It started to go back to normal color, and he never had to have a skin graft for the several years he was a patient. He moved out. I don't know what happened to him. But he said his whole family had this, and his sisters were on high levels of Coumadin and other blood thinners. And he tried to get them to change, but really it's a matter of he changed his diet and he took care of it. But I think their systems, if you have this factor 2, are more sensitive to maybe fried foods, junk food, heavy metals, vitamin D deficiencies, and that's why they get. So if you clean all that up, I think you'll be surprised at what kind of results you will get. I'm Dr. Merkle. Stay healthy. If you need some help, contact Science-Based Nutrition. We can lead you in the right direction. If you're a doctor, get testing properly and you'll see results like we do. I'm Dr. Merkle.